USMLE style question. A 42-year-old man presents to the clinic with a 6-month history of involuntary movements and difficulty concentrating. His wife reports that he has been more irritable and impulsive, and his movements have become uncontrollable. His father had similar symptoms and died in his 50s. On physical examination, the patient exhibits Chorea-form movements of the hands and face. MRI of the brain reveals atrophy of the caudate nucleus and putamen with enlargement of the lateral ventricles. Which of the following is the most likely underlying pathophysiology of this condition? A. Loss of dopaminergic neurons in the substantia nigra pars compacta. B. Beta amyloid plaque accumulation in the cerebral cortex. C. Trinucleotide repeat expansion in the HTT gene leading to neuronal toxicity. Demyelination of the central nervous system due to autoimmunity. E. Loss of acetylcholine-producing neurons in the basal forebrain. Answer and explanation. Correct answer. C. Trinucleotide repeat expansion in the HTT gene leading to neuronal toxicity. This patient presents with Huntington Disease HD, a neurodegenerative disorder characterized by chorea, involuntary, irregular, purposeless movements, cognitive decline, dementia, difficulty concentrating, psychiatric symptoms, depression, irritability, impulsivity, family history of similar symptoms, autosomal dominant inheritance. The underlying cause of Huntington disease is a trinucleotide CA repeat expansion in the HTT gene on chromosome 4, which leads to a toxic gain of function and neuronal death via glutamate excitotoxicity, NMDA receptor binding. This results in atrophy of the caudate and putamen, causing ex vacuo ventriculomegaly due to loss of brain tissue. Incorrect answers: A. Loss of dopaminergic neurons in the substantia nigra pars compacta, seen in Parkinson disease, which presents with bradykinesia, rigidity, resting tremor, and postural instability, rather than chorea and psychiatric symptoms. B. Beta amyloid plaque accumulation in the cerebral cortex, characteristic of Alzheimer's disease, which presents with progressive memory loss and cognitive impairment rather than chorea and psychiatric changes. Demyelination of the central nervous system due to autoimmunity, seen in multiple sclerosis, which presents with relapsing remitting neurologic deficits, optic neuritis, weakness, sensory loss, cerebellar symptoms, rather than chorea. E. Loss of acetylcholine-producing neurons in the basal forebrain associated with Alzheimer's disease, leading to memory loss rather than movement disorders. Key learning points: Huntington disease, HD, genetics, autosomal dominant, CAG repeat expansion in HTT gene on chromosome 4, pathophysiology, toxic gain of function, neuronal death via glutamate excitotoxicity, NMDA receptor overactivation, brain changes, caudate and putamen atrophy, ex vacuo ventriculomegaly, neurotransmitter imbalance, dopamine, acetylcholine, symptoms, chorea, involuntary, purposeless movements, cognitive decline, dementia, poor executive function, psychiatric symptoms, depression, aggression, psychosis, diagnosis, genetic testing for CAG repeat expansion, treatment, symptomatic only, dopamine antagonists, tetrabenazine for chorea. Would you like a follow-up question?